This is the Varistress test. I perform this bilaterally. Positive test is increased pain or laxity. Implications are moderate laxity is damage to the RCL. Gross laxity would indicate a tear or damage to the annular ligament or LUCL, and any laxity in full extension indicates a fracture to the olecranon or the humerus. This is the valgus stress test. I perform this bilaterally. Positive test is increased pain or laxity. Implications would be a tear to the anterior band of the UCL. If it's more than 6 degrees flexion, then a tear to the posterior band of the UCL, or if there was laxity in full extension, a fracture to the olecranon or humerus. This is the moving valgus stress test. A positive test is any pain that causes apprehension or pain within the 70 to 120 degrees of flexion range, or pain in the same spot of flexion and extension. The implication is a valgus extension overload or tear to the UCL. This is the milking sign. Bring your arm up and support your arm there for me. A positive test is increased laxity or pain, and implication is a sprain or tear to the UCL. This is the Tinel sign test. Positive test is burning or tingling, and the implication is an ulnar nerve pathology. This is the hook test. You can slightly bend your arm. Positive test is inability to hook the distal biceps tendon. Implication is rupture of the tendon. This is the medial epicondylitis test. Positive test is pain over the medial epicondyle. Implications are medial epicondylasia and golfer's elbow. This is Cozen's test. You bend your elbow. Make a fist for me. Lateral epicondyle. And I want you to push up against the wrist. Push, 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 push. And hold it. Positive test is pain over the lateral epicondyle. The implications are lateral epicondylasia or tennis elbow. These are the upper limb tension tests. In the first test, we are evaluating the median nerve, the anterior interosseous nerve, and nerves C5 through 7. This is the second upper limb tension test. The second test evaluates the median nerve, the musculocutaneous nerve, and the axillary nerve. The third test evaluates the radial nerve. And the fourth test is evaluating the ulnar nerve and C8 and T1. If the patient had a positive test for any of those, I would back off and have them laterally flex their head to the opposite side. We always test the good side first. The positive test is reproduction of symptoms, tingling or burning pain, a decrease in mobility on one side compared to the other, and the implication would be nerve tension. This is Mills test. Palpating the lateral epicondyle. A positive test is pain on the lateral epicondyle when that motion is performed. The implications are lateral epicondylasia or tennis elbow. This is the posterolateral rotary instability test. Bring it up to 90-90. Applying an axial load, a valgus force, as I extend the arm out, and as I flex the arm back in. A positive test is if the elbow would sublux while they go into extension and then relocates in flexion, and the implication is chronic instability. This is the tabletop relocation test. I would ask the patient to perform a press off the table. If the patient then felt pain or apprehension at about 4 degrees of flexion, I would then ask them to re-go into the position. I would find the radial head, and I would ask them to perform the same thing. A positive test is pain or apprehension at about 40 degrees of flexion. That decreases once that pressure is applied to the radial head. The implication is posterolateral rotary instability. This is the elbow flexion test. I would ask my patient to fully flex their elbows, have their arms supinated, and extend their wrist. I would then ask them to hold that position for 3 minutes. A positive test would be reproduction of pain, any tingling, or numbness along the distribution of the ulnar nerve, and the implication is cubital tunnel syndrome. This is the scratch collapse test. First, I would ask the patient to resist external rotation. I would then briefly scratch the ulnar nerve and ask them to do this again. Positive test is a brief loss of strength and of external rotation, and the implication is cubital tunnel syndrome. This is joint play. First joint I will be doing is the humeral ulnar joint. Bring him into 70 degrees flexion, and then I'm going to be bringing 10 degrees of supination from neutral. I'll be stabilizing proximally and then applying a distal distracting force. Next I'll be performing the radial ulnar. So once again I'll keep that 70 degrees of flexion. Going to be bringing him into more supination on this one. And I will be applying an anterior-posterior force to the radial head, and then a posterior-anterior force. Finally, I'll be performing the radiohumeral, bring him into full extension and slight supination, stabilizing the proximal humerus, applying a posterior-anterior force to the radial head, and an anterior-posterior force. Positive test is hypomobility, hypermobility, or pain. Implications would be any restrictions in all articulations may indicate a loss of elbow motion. Hypomobility at the radial ulnar joint is associated with restricted supination and pronation.